Hi, good night, everyone. Thank you so much for tuning in for this session. Thank you, Yahweh's Kingdom Lifestyle Ministry, for giving me the opportunity to present here tonight. The only thing is my internet is down a little, so if I sound a little strange, that's okay. I am Miss Fontenelle. I live and work in St. Lucia, like I said previously. I have been a registered nurse for almost 8 years now. I hold a bachelor's and a master's degree in public health. I enjoy teaching, discussing, socializing, having fun, going out. I run a blog about tropical living. It is ourtropicalliving.com, so you could go to view that. And I have an inspirational YouTube channel and a vlog called Rim Son Son. So you could also subscribe to my Rim Son Son channel on YouTube. You could follow me on Facebook as Our Tropical Living. And you could also follow me on Instagram, where I go by the name Rim Son Son and Our Tropical Living. So tonight we will be discussing contraceptives. What exactly are contraceptives? Do you know what are contraceptives? Okay, so let's see. Contraception or birth control is an action taken to avoid conception. So before we begin, let me share some information, especially if you want to start contraceptives and if you do not know what exactly you should do. A family could discuss the types of contraceptives that they would like to use to prevent unwanted pregnancies, to time or space pregnancies, or to even prevent unsafe sex. So basically, it's to practice safe sex. Families could choose the contraceptive that works best for them, but the affordability, availability, accessibility, and acceptability, and even the effectiveness of contraceptive method can be considered. Contraceptive counseling could be obtained, or persons could voluntarily make informed choice of contraception for the success of contraceptive methods. So it is best to discuss contraception with a medical personnel to determine the best method that you could use, especially depending on your medical history, your personal lifestyle, your preference, and even your future plans. When choosing the method of contraception, you need to remember protection from HIV and other STDs, and even STIs. Okay, so we're moving on to barrier contraceptives. Barrier contraceptives were primarily used just before the modern era, and it includes things like condoms, cervical caps, and contraceptive sponge. Barrier contraceptives were considered to be messy before. They were considered to be unromantic. Although they have no major health effects, they could cause serious allergic reactions, and sometimes the allergic reactions can be rare. So there are different types of contraceptives, but the commonly used ones will be highlighted. We're moving on to spermicides. And spermicides are products that work by killing sperm. Spermicides come in foam, they come in gel, cream, film, suppository, or even tablet form. So they are placed into the vagina no more than 1 hour before intercourse, and they can remain in place for at least 6 to 8 hours after intercourse. Spermicides work quickly, and they help prevent some forms of STIs. So have you heard of spermicide? A spermicide can be used in addition to a male condom, a female condom, a diaphragm, or a cervical cap, just to help to kill or immobilize the sperm at the same time. So if you do decide to use a spermicide, remember, you have to keep it in place for at least 6 to 8 hours after intercourse, and you should use it alongside other methods to prevent contraception. The common side effects of the spermicides include things like yeast infection and also urinary tract infections. We're moving on to the next slide, that's the diaphragm. It could be replaced every 2 years, but it is shaped like a shallow cup. And they are placed inside the vagina just like the caps. to cover the cervix and to stop sperm from getting into the womb. It should be placed before sex, and a spermicidal agent should also be used. But before you put the diaphragm, it is important to visit your doctor for proper fitting because the diaphragms come in different sizes. You could place the diaphragm for at least 6 hours before you have sex, and you should leave it for at least 6 hours after you have sex. Some individuals develop allergic reactions to the diaphragm, and that's mostly due to the latex. So if you're allergic to latex, then diaphragm is not something that you should use. So what exactly is a cervical cap? A cervical cap looks just like a small deep diaphragm, and it could be inserted by a doctor, but it should be changed every year. It can be placed hours before sex, and it can be left for at least 48 hours after sex, but it should remain in the vagina for 6 hours after sex. So far we've gone through spermicides, diaphragms, and the cervical cap. I know these are basically foreign ways of contraceptives. The side effects of the cervical caps, they are rare, but sometimes individuals develop allergic reactions to the latex. But persons with reproductive tract infections should not use cervical caps. Okay, so we're moving on to the male condom. I know most individuals know about condoms. Condoms act by catching and collecting semen so that it does not enter the vagina. And the male condom is worn by a man, of course, and it should only be used once. So you should not go and wash your condom. If it has semen in it, you should not try to use it again because it's not good after the first use. Latex condoms are the most common type used to prevent pregnancy and even HIV and other STDs. And the natural and the lambskin condoms are also used to prevent pregnancy, but they may not protect against STDs. So you have to be aware of the type of condom that you use. Water-based lubricants can be used with condoms, but the oil-based lubricants, such as massage oils, baby oils, lotions, even petroleum jelly, should not be used with latex condoms. When the oil-based lubricants are used, they tend to weaken the condom, and that can cause tearing and even breaks. So that can increase the risk of getting pregnant and even developing HIV and other STDs. So the condom should be stored in a cool and a dry place. Do not go and put your condoms in the freezer or in the fridge or expose it to extreme temperatures. The tip of the condom should be pinched before application. And remember, the condom should only be used once. The female condom, it is used by the woman, of course, and it's partly or completely covers the outside of the female genitals, and it acts as a barrier for the sperm. So the female condom, it's packed with lubricant and it helps keep sperm from getting inside of the woman. It can be inserted for about 8 hours before sexual intercourse, and the female condom has to be stored in a cool and dry place, and it should be used at least once. So both the male and the female condom should be used once. The sponge is another form of contraception that can be used. It contains spermicide and it is placed in the vagina where it fits over the cervix. And you can see a small diagram. The sponge works for up to 24 hours, but it must be left in the vagina for at least 6 hours after the last act of sexual intercourse, and it should be removed and discarded thereafter. The contraceptive sponge is it's a one-time use, but it can be used within 24 hours. So you could put in the sponge for at least, you can have it for the whole day. So you can have sex as many times as you want, but it should only be used one time. Okay, so we're moving on to the IUD. The IUD, it's an intrauterine device, and it's a small device that is inserted into the uterus to prevent conception. Now, that is something commonly used by women, and it is shaped like a T. So it is a small device that is shaped like a T. It can stay in the uterus for up to 10 years. So women can have a copper T IUD inserted within 5 days of unprotected sex, and that can act as an emergency contraceptive. But just remember that it has to be placed within 5 days of unprotected sex. So you can see in the diagram, that's a surgical sterilization. That's another form of birth control. So women that feel like they have had as many children as they want, or they just do not want to have children, then surgical sterilization can be done. It's also called female sterilization, tubal ligation, or tying of the tubes. And it occurs when a woman have her fallopian tubes tied or closed so that sperm and the eggs cannot meet for fertilization. Of course, this requires hospitalization where the abdomen is opened and the fallopian tubes are tied. So since we're on the surgical sterilization, male sterilization can also be done. That's the vasectomy. It's a surgery that is done to keep a man's sperm from going to his penis. And it also requires hospitalization. So if a man feels like he doesn't want to have any more children, or he just doesn't want to have children, then he can have a vasectomy. But remember, these things are unreversible. So since it's irreversible, definitely you will not have children. But compared to the female sterilization, for the male sterilization, it is important for a man to visit his doctor to get a sperm count done to ensure that the sperm count is 0. So it is another form of birth control, because if the sperm count is 0, then that means the man obviously will not have any children. So it's advised that individuals who have a vasectomy, that they only have sex when the sperm count has dropped to 0. So there are many other types of contraceptives. I mean, there is the pill, that's an oral contraceptive that's commonly used by women, and it contains hormones, especially estrogen and progestin, but that has to be prescribed by a doctor. And the pill is taken at the same time each day. So if you forget to take the pill, well, that's for women. If you forget to take the pill, then you should try to take it, but continue taking it at least the same time every day. For individuals who are over 35, for individuals who smoke, those who have history of blood clots, or even breast cancer, then the doctor may not advise that you take the pill to prevent further medical complications. There are different types of pills. The progestin-only pill, it is only progestin, and it's sometimes called a mini pill. It only has one hormone instead of both estrogen and progestin. So as with the commonly used pill, the progestin has to be taken each day around the same time. So it is a good option for women who cannot take in any estrogen. Another commonly pill used is the emergency pill, or it's also called the morning after pill, and it is taken 72 hours of unprotected sex to help delay ovulation and even the lining of the uterus. Women can take in emergency contraceptive pills for at least 5 days after unprotected sex, but the sooner the pill is taken, then the better that they work. Some emergency contraceptive pills require prescription, but others are available over the counter. So if you have unprotected sex tonight, then tomorrow you could go over the counter to purchase the emergency contraceptive pill. But it is important to remember that the emergency contraceptive pill, it is not a regular method of birth control because it can have serious side effects if it is used continuously and for how many times. So the emergency contraceptive pill can be used after no birth control was used during sex, or if birth control methods failed, such as if the condom broke, or if somebody placed a hole in the condom, because I know some people do that. So another commonly used method is coitus interruptus, and that is called withdrawal. In my country, in St. Lucia, it's called bail-off, and it is mostly practiced by men, but it has a high failure rate. So I would not advise anybody to bail off or practice coitus interruptus or withdrawal because the woman can still get pregnant. Coitus interruptus occurs by withdrawing the penis during sexual intercourse before ejaculation takes place. So some men, they feel the time that they will feel like they will ejaculate, so they tend to pull out, but that is not a safe method. The skin patch is another alternative that is used, and it is worn on the lower abdomen, the buttocks, and even the upper part of the body, but it is not placed on the breast. It releases hormones such as progestin and estrogen into the bloodstream. But a new patch should be used at least once a week for 3 weeks. And then during the 4th week, the patch is removed just so that the woman can have a menstrual period. So we all need to understand our monthly cycle, that's women, of course. Especially if you want to get pregnant, if you want to avoid getting pregnant, or if you just want to monitor your period. Your fertility pattern can be used to know the number of days in the month when you are fertile and when you are able to get pregnant, and it can also be used to know when you are not fertile, that's when you are infertile. So you can determine the time that you are unable to get pregnant and the days when fertility is unlikely, but it is still possible. So a commonly used thing is a period tracker, and that can be used to understand a monthly cycle and just to show the most fertile days. So if you have a regular menstrual cycle, you have about 9 or more fertile days each month. So if you do not want to get pregnant, then you should not have sex within those days, or you should use effective contraceptive measures. Barrier methods could also be used on these days, such as, well, use the condom, use the cervical cap, or even the diaphragm. I know that these things are not really used in this era, but if you're comfortable with them, then you can use them just to help reduce the probability of you getting pregnant. So for women who recently had a baby and are breastfeeding, not having any menstrual period after delivering a baby, fully or nearly breastfeeding, and if you are less than 6 months after delivering a baby, then you could use that as a form of contraception, but it is a temporary method of birth control. So you should remember to use another birth control method so that you do not get pregnant. I know some women say because they are breastfeeding, then they have unprotected sex because that can limit the possibility of them getting pregnant. But some individuals still do get pregnant when they are breastfeeding. So just remember, if you have not had a period, if you are newly or fully breastfeeding, and if it is less than 6 months after delivering, then that can work. But it is not advised that you do that to prevent unwanted pregnancy. So although hormonal contraceptives and IUDs are highly effective at preventing pregnancy. They do not protect against STDs, including HIV. So it is important to use other methods, such as the condom, because it reduces the risk of HIV infection and, of course, other STDs, including chlamydia, gonorrhea. So we need to be mindful of such. The only way to prevent pregnancy is, of course, to prevent vaginal intercourse. So just abstinence. Do you have any questions? Hello? Any questions? Okay, well, thank you for tuning in for this session. I'm Rim Sonson, and see you next time.